Get started. Good evening, ladies and gentlemen. Welcome to today's edition of Applied Neolife. I like also to call it Team Training Tuesday. However, guests are most welcome. In fact, the series this year is geared towards guests, new distributors, and everybody in the Neolife family. We continue with confounding disease conditions, and today we are looking at HIV and AIDS and asking ourselves, what makes HIV a confounding condition? That's the question we want to answer. But we also want to focus mainly on nutrition and lifestyle habits in HIV. Introducing us, Doctors Edward and Essa Zanambasi, that's us there in our current state. We are passionate to see individuals and families healthy and happier, and that has actually been our mission for over 50 years, if I can say so. Having seen HIV from the beginning, we first started seeing it in the early 80s. We had the opportunity and the privilege to see how powerfully nutrition and lifestyle modifications could change the course of health for individuals. And obviously, when later we were shown what we want to share with you, which is the Neolife family, we saw exactly how we could use the product to change lives. So the core message is education about the power of choice. I want to give a little bit of background, and this is just interesting food for thought. Louis Pasteur, he lived a long time ago, the last century or the century before, discovered that microorganisms were responsible for infections, right? We probably know that bit of history. And so he is also credited with being one of the fathers of immunology. And he worked for several years, but late in his life, he realized that strengthening the body rather than conquering the invading organism might prove a more effective strategy. Now, that's him who discovered a lot of microorganisms. Sadly, for the past 130 years, we seem to still focus on trying to destroy the invading organism. For example, the types of medications and drugs we have, antibiotics, we are increasingly seeing that danger of resistance being formed. There are resistant strains, and it's a big, big problem. And then, of course, antiviral agents, which we want to talk about today, partially. There is resistance that develops due to mutation, okay? And then, of course, chemotherapy and anti-cancer medications and other things, antidepressants, all those things are problematic in that they do not address the root cause. Now, let's turn our attention to HIV, the topic for today. And I just want to say it is important to test, because usually there's a long time between infection with HIV and the manifestation of symptoms and signs, a very long time. Lifestyle habits may have to be changed once one knows, or even before one knows. I think this is generally to speak to everybody. Lifestyle habits have to be changed to enhance and to maintain a strong immune system. And then there's as regards HIV, the very real challenge of infecting another person can and must be avoided. And that's why it's important to test. And stigma and discrimination cause psychological trauma, right? We probably know that, but we probably passed that severe stage of stigma and discrimination. But it was quite a thing that kept people in secrecy because of stigma and discrimination. Anyway, empathy is always called for, and I truly believe that there is hope. Basically, because I have devoted my medical practice and career for several years to HIV management. But now I'm more focused on health and wellness, as you probably know. Right, this is a picture just to show what HIV is. I'm sorry about the quality of the picture, but HIV is the virus that destroys cells of the immune system, and AIDS is the most severe stage of HIV infection, and it includes a lot of opportunistic infections. The two are not the same, all right? HIV is not equal to AIDS. There was a time when people were mixing it all up. So opportunistic infections include things like chronic and severe thrush or candidiasis. People may become anemic, they may lose a lot of weight, they may develop meningitis and other problems, may develop tuberculosis and chronic diarrhea, things like that. So, in other words, somebody can have HIV infection without necessarily having AIDS, unless it is really advanced stage. And then transmission is there at the bottom. I won't dwell too much on that because things are changing. I just want to highlight that we need to know, all right? Let there be light. It, by knowing, you can then look at ways to improve the immune system. And the immunity depends on nutrition. It is crucial to avoid foods that keep stressing the immune system. I like to call them inflammatory foods. Exercise is important. It has to be appropriate and correct because overtraining suppresses the immune system. However, if you do enough exercise, appropriate exercise, you enhance the immune system. So it's all about knowing and about balance. And then sleep. Good quality rest and relaxation enhance the immune system. And then we often advise stress management. All of us need to learn how to manage stress. In all ways that stress manifests, the body responds with stress hormones that are immunosuppressive. So over and above having an infection with a virus that is destroying immune cells, one needs to know that there are other factors, lifestyle factors that need to be taken care of and controlled. And then supplements. Supplements are no longer optional. However, it is important to know how to choose them correctly. And that's what we want to share with you as we go into our presentation. So when all is said and done, nutrition is a critical determinant of immune responses, and malnutrition, the most common cause of immunodeficiency worldwide. Even without HIV, malnutrition causes a lot of immunodeficiency. So now let's focus on the immune system itself. It is complex. It is actually a remarkable system. We need to know the basics, the fundamentals, to help us to know how to enhance it. And of late, attention has been turned towards strengthening the immune system. Amazingly, that has been the core message by Neolife since 1958. So for the guests, welcome to this presentation, and I just want to assure you that you are in the right place, and the person that has invited you will give you further information. Now, our immune system, we can call it an army of immune soldiers. There are three main types of white blood cells. We have the B lymphocytes, the T lymphocytes, and the macrophages. I'll sort of go through this part very quickly. B cells and T cell lymphocytes work together, they collaborate. When B cells encounter an invader, in other words, something that causes them to become activated, they swell and divide into several cells, and they secrete specific antibodies, antibodies that cling to the invader. In other words, they are involved in arresting that invader. Then antibodies also call for help by the T cells. That is the collaboration. As soon as they sense something, they ask the T cells to come along and help. And so now there are three types of T cell lymphocytes. We have the T helper cells, lymphocytes, the T suppressor lymphocytes, and then the natural killer cells. So they all work together as a big, amazing team. A virus cannot reproduce unless it is inside a cell of the body. Once inside, it can take over the control of that cell, and it can reprogram to make more viruses. So that is why before they go inside the cell, these are pictures of the cell and the mitochondria. You probably have seen this visual. Before they go into the cell, it is important that the white blood cells secrete the antibodies to arrest, and then they call the T cells to get rid of it, okay, of the virus. That is the ideal. But this picture now wants to show you what happens. The virus comes along and it will attach to a cell. And if it is not arrested, it will penetrate that cell. And then it will get in there and reprogram the cell. And that's what we call biosynthesis, and reprogram it to form more viruses, more virions, many, many viruses. And then it uses the genetic material that is within the cell, the DNA and the RNA, to assemble new viruses, and then those are released. Billions are released, and then they'll go and do likewise. This is the event of the immune system being either incompetent or lower than it should be from various factors. Okay, so what am I saying? Let this be any virus, but today we are discussing HIV virus, but this goes for any virus. One needs to have a competent immune system at all times, and that's what we are discussing. So, what happens in HIV infection? Well, HIV selectively destroys T helper cells that we call CD4 cells, the CD4 line of cells. The ratio of T helpers to T suppressors should ideally be 2:1. So they should be more helpers than suppressors. As helpers are destroyed, that's what HIV goes for, and therefore cannot call up B cells to produce antibodies. The immune system becomes depressed, and that opens the way for other infections. So what actually causes most damage are other infections. Now, I just want us to discuss briefly the lymphatic system. After this, I'll speed up even more. The lymphatic system is the body's sewage system, and the three main functions of the lymphatic system are immune responses, tissue drainage, and fat transportation. And if you recall, fat is important in the immune system. It's very, very important as long as it's the right kind of fat. So that's just a quick picture to show a lymph node where lymph flows in through the node and then it flows out again, and there are valves, and inside there they're densely packed with B and T cells, macrophages, and other cells as well. Now, just so that we know, these are the important lymphoid tissues and organs. They are the primary ones, the bone marrow and the thymus, and then the secondary ones, which also are important, the spleen, lymph nodes, tonsils, various membranes in our body, in the gut. We call those gut-associated lymphoid tissue. And then you have them in the bladder, in the lungs, in the brain, everywhere, actually. So now that we know that there's lymph tissue everywhere and lymphatic system everywhere, the battle that goes on to try and get rid of invaders, including viruses, there has to be a cleanup process. So that's where the macrophages come up and clean up after the battle has happened. Okay, so once the B and T cell lymphocytes have been at them, macrophages, those are specialized cells, will come and clean up. And that's where the immune system in the lymphatic system is important. Right, there are always some immune cells on duty, keeping watch. T cells have a short lifespan of about 4 days. Now, that is critical to know because when we are talking about the value of nutrition and supplementation, particularly tools such as amino acids, antioxidants, right? You'll understand why it is important to be consistent with supplying what is required by the body. Anyway, an invader triggers release of new soldiers from the bone marrow and the thymus gland that is triggered, and there is actually a memory. It can remember. And new soldiers are then posted in lymph nodes, tonsils, the appendix, the gut, the spleen, and it will explain, for those of us who worked for years in HIV, we used to see people in the early stages of their disease with swollen glands, okay? And that explains it because that's what happens. The glands and all the secondary lymphoid tissue swell up. This is just a picture to show macrophages and they clean up. But now, we have talked about gut health and mentioned it on several occasions. I want us to know that in the topic for today, the confounding disease condition called HIV infection, it is important to know that over 70% of the immune system resides in the gut. So as we connect dots, I want us to realize that we have the responsibility to ensure that the gut remains as healthy as possible. And gut healing should be the focus for each and every one of us, because it has been said that by about the age of 40, if we live as we want and don't really mind what we put in our gut. A healthy gut would become a leaky gut because of all the things that are going on in there, such as infections, such as lowered stomach acid, for example, to treat heartburn. People have a way of taking antacids and then other medications to treat arthritis and pain and things like that. And then, of course, stress and various toxins. So I want us to just become aware that we can do something, we can become proactive. Right, I'm now changing the topic a little bit to discuss a syndrome that we call IRIS for short. It is immune reconstitution inflammatory syndrome. That is when there's flare up of an underlying or previously undiagnosed infection or worsening of a previously treated infection. And if you remember, we actually touched on this topic last week when we discussed it about when we were discussing autoimmunity. It actually refers to a healing crisis in the sense that improving and repairing damage caused by HIV to the immune system might manifest as worsening of symptoms. And that is the point at which a lot of people become confounded, become confused. Okay. And last time that we discussed this, we said even with our supplements, because there is repair work going on and improvement, they might initially be worsening at the outset, and then people give up and blame the supplements. So it happens also in HIV very commonly. And unfortunately, the conventional way of treating, let's say somebody has been started on ARVs, which I know very well about. The conventional way would be to give steroids to suppress the immune system. Now, in HIV in particular, that can be counterproductive because one already has a suppressed immune system. You don't want to suppress it any further. That's the point of this part of the story. So I thought I would give you some case studies that came to mind. These were patients that I personally saw. And this is just to explain immune reconstitution inflammatory syndrome and why we need to know about it and be able to be proactive, all right? So my first patient was diagnosed positive, and I advised supplements to prepare her for ARV. I said, please use some supplements. By the way, I need to just let you know that I was in private practice when all this was going on. I wasn't in government service. So I pretty much could do what I felt was best for my patients. And I knew that I had very good supplements as well. So yes, she agreed, but she said she would only use 2 because of budgetary constraints. That's okay. I recommended the 2, and I said for at least a month as we collect all the test results. Within 2 weeks, she was back with symptoms and signs of hectic, really severe pulmonary tuberculosis. And I was thrilled. I promise you, I was so happy because it is important to treat such problems before starting ARVs. So she was successfully treated for the first couple of weeks. And then we started her on ARVs. And She did very well. Her CD4 count rose from way below 200 to way over 800 by the time she completed her TB treatment. So that was, for me, a success story. Then the other patient I saw, she commenced on ARVs because of having a low CD4 count. Her CD4 count was below 150. A year later, her CD4 count did not rise above about 440. I think that was as much as she got. So I said to her that, you know what, it might be a good thing for you to use some nutrition supplements. I've got a good quality one. Please use them. And she was very eager because she said she was tired of feeling sick and tired. Then, in about a month or a month and a half, she developed weakness of the lower limbs. Then she came for a physical examination to my rooms and investigations. And again, after investigating and examining her, a diagnosis of tuberculosis in the spinal canal was made. So she commenced on TB treatment. The neurological symptoms resolved and signs resolved. And after that, her CD4 count soared from where it had plateaued, even on ARVs, to way above 1,000. Okay. And she's been well since I knew her in 2005. So what are we saying? Nutrition is important, but it can be confounded in that it will initially clean house. You've heard me say that. It comes in there and cleans up and looks for challenges. And then after that begins the rebuilding. Right. So what else could it be? Should be a question that we have to ask. Because if left unattended, HIV infection can move on to AIDS. And I've given you those two examples just so that we know that it is a real possibility. It is important to be intentional about knowing how to choose. Choosing not to drink alcohol, for example. But it is also important to ask this question at the bottom, what else could it be? Because now that the HIV has matured around the world, immunodeficiency, we are seeing a lot more malignancies, cancers, than we used to in the beginning. So that is a question that we should ask. What else should it be? Can it be? Might be malnutrition, severe malnutrition. In fact, I think often it is severe malnutrition. Right, so I'm going to now focus on solutions. I believe the responsibility to apply near-life solutions begins with knowing why and how to choose. So this part will go quickly. I would like to introduce the visitors and the new distributors and everybody to the Scientific Advisory Board. This was founded by Dr. Arthur First. He was an amazing toxicologist, pharmacologist, and cancer researcher. His pioneering work gave us oral chemotherapy. But round about the mid-90s, 1996, or maybe earlier than that, when ARVs came onto the market, I strongly believe, I truly believe that it's because of his work to create oral chemotherapy that ARVs came to be. Because they too need to be able to enter the cell to work. That is very important. I showed you that picture of how the virus enters the cell, and a virus is an intracellular what we call an obligate intracellular organism. So that is the importance of what we have here. The scientists behind our products are truly amazing. And Dr. Arthur first came to Neolife in the mid 70s and started the scientific advisory board, and we've got new members on it. They tell us that stick to the basics. As long as you eat good food, do some exercise, make sure that you hydrate, get some sunshine and fresh air. They also emphasize the importance of nutrition. And what they have done is to harness real food, okay? Real food, and give it to us in the form that we know it as supplements. These are products that truly work, and I hope those examples of immune reconstitution have impressed it upon you. So we have the concept of core nutrition. And what it is it's, okay, let me just go back to the slide before. Core nutrition, it has a set of products called Pro Vitality and amino acids in Neolife Shake. That is what we call foundational. That is actually what everybody requires to maintain a functioning immune system. I said the T cells live for about 4 days. So it is important that if you can't supply amino acids every single day as you should, if you can at least supply them twice a week, you'll be giving your body a head start. Now, within there is this product called carotenoid complex, a truly revolutionary product. Clinical trials that were done during the development of this product proved that when taken consistently, carotenoid complex boosts the immune system by 37% in more than, or more rather. The actual study said 37.4%, okay, in just 20 days. Now that is phenomenal. And I believe my patient all those years ago, whom I said, use these products. So I advised her to fit in her budget, TRIANN and carotenoid complex. And she comes back with the immune system boosted sufficiently for TB to be found. That was the reason for that story. So please use this product. It is phenomenal. And along with it, we have vitamins. Vitamin C is vital against viruses. Okay, it is important for other things as well. It works even better when combined with flavonoid. And in here we have cranberry extracts, which are super important against common infections such as urinary tract infections, cystitis, the bladder infections, just by the way. So that's what Pro Vitality looks like. And then you can add other products such as minerals. We have zinc, which is important for the immune system. We have a few other minerals as well. We also have this pack for those that are really wanting a good combination to help the immune system. This pack comes with 3 carotenoid complex, 2 flavonoid complex, and a cruciferous plus, which is important for detoxification. Now, when there is an ongoing battle to control invaders, it is important as the body is cleaning out to help it with cruciferous plus, which is vital for detoxification. This pack will give you optimal daily servings to fill a huge gap in the diet of these carotenoids, flavonoids, and cruciferous. And it is particularly important for boosting the immune system. And then I just want to spotlight this, and then we'll finish and have a discussion. We'll finish soon. Garlic and beta guard. Beta guard was the first item on Dr. Arthur First's agenda when he came to Neolife, because he needed something to defend ourselves. He wanted to make something to defend us and to also detox very efficiently, having created oral chemotherapy. So I would always recommend anybody who is on chronic medication with ARVs to detox regularly. It would be very important. And then, of course, we know that garlic, part of the detox program, is important as an antiviral, antibiotic, antifungal. That's not to say stop your ARVs and use garlic only. No, these are supplements to help your body and to help your immune system to function better. I hope that is clear. Okay, very quickly, your environment is very important. Make sure you are not using toxic products, because over the past about 60 years or more, many chemicals have been added to our day-to-day use, and we find them in food, water, detergents, personal care, fabrics, furniture. And so where to look first when you are saying, how can I reduce the stress on my body, is look at what you're cleaning with. Because a lot of people manifest stress by gathering or the body collecting a lot of fat. And they, it's difficult to know. Already there is that battle going on with the viruses being brought under control. There are the ARVs themselves, then there is life happening. So a lot of people have this as a challenge, laying down a lot of fat. I want us to intentionally decide that, yes, I'm going to change my cleaning products so that I use high quality products that will make a difference, not only to anybody who might not be well, but to the whole family, including the kids. Now, a product like LDC is so versatile, as is Super 10, that, wow, no home should do without it. And then, of course, stress can come from chemical exposure to our detergents. So change to this one, which doesn't have phthalates, it doesn't have fillers, it doesn't have all sorts of things that are endocrine or hormone disrupting. Then we have a skincare range, which is pure. It is based on marine botanicals. It is also a way to reduce stress. And then I want us to remember exercise is important. We are on a mission to make the world a healthier and happier place. And those are the things to take care of: diet, physical activity, stress management, rest and relaxation, and of course, appropriate supplementation for preventative maintenance of health and well-being. It isn't something you do when you feel ill, you do it all the time. Variety and balance in life, the choice is yours. We've shown you what you can choose, and we highly recommend that choose something that is life-giving. And when you do, I hope you will also choose to come to the family that is on a mission, because you can have your own business and you can share with as many people as you know. Awesome. Thank you so much. We shall have a few minutes to discuss. I'll stop the recording.